about auto no fault and some of the reforms that were passed during the last couple of years. So realistically, we're not done working on those reforms. I mean, there's a ways to go, and I consider it a work in progress, and there's a lot more progress that needs to take place. So much of the new law took effect July 1st. We saw letters, emails, and calls coming into our offices from providers. So we reached a short-term stopgap, but we wanted to keep as many caregivers in Michigan as we could. The legislature created a $25 million fund for caregiver providers to access if they could prove they were not receiving satisfactory reimbursement for the services they provide to care for those who have been catastrophically injured due to auto accidents. The problem with that stopgap measure is that it will take several months, possibly in the next year, before any caregiver providers will be able to tap into those funds as they go through 12 rounds with the insurance company and the appeals process. So there's a lot more than just applying and getting reimbursed. So I'd like to see continued action for long-term structural reforms to be put in place to ensure that caregiver providers are economically sustainable in our state, as well as finding more ways to drive down the continued high cost of auto insurance. One thing we have to look at in how caregivers are provided payment and reimbursement is, will that actually take care of the patient? Are we still taking care of the patient at a satisfactory level so that we're not harming that patient and making sure that they can go forward? So I've introduced many bills that are conversation starters. Not necessarily the answer, but good places to look for savings and innovations to help those who need long-term care, and to find ways to make auto insurance more affordable and reasonably priced. So the first of the initiatives would be to offer consumers more choices on their deductibles. House Bill 4555 would require insurers to offer $1,000 increment deductibles to reduce premiums for no-fault insurance. Currently in this state, when you have a deductible on your auto insurance, the deductible is only on the car side. In other words, to repair your car. There is no deductible on the health side, where it'd be sufficient to say you could get $1,000 deductible on your health side, which would reduce your premium. So that to me makes a lot of sense. And if it got to a point where the deductible was high enough, it might cover the whole cost of any type of accident or care that you would need. Now, one thing to tie in with this is to see if employers would be willing to pick up those deductibles. They then would have a certain amount of money that they knew they would have to dedicate if you got in an accident. But then there wouldn't be anything open-ended like there could be on a regular health policy. So it's an interesting concept. I think it works, and it would lower the premiums for everyone in the state. Plus, it would take a lot of dollars out of the no-fault system that wouldn't necessarily have to be there. Secondly is House Bill 4809. So this bill would fix the no-fault reforms that we passed for motorcycle riders. Now, what happened on the reform is we inverted the priority, the way a motorcycle rider could be taken care of under the insurance. However, when we did that, we left a lot of riders out in the cold if they get hit by an uninsured motorist. So what I want to do is reverse that back to where it was, and it'll make sense for all the motorcycle people that live and ride in the state of Michigan. So our third proposal is House Bill 5169. Now this proposal would ban liens on third-party torts. What's a third-party tort? Well, if your insurance company only pays so much and you have to file suit against this person that caused the accident and your injury, then that would be a third-party tort. What happens, though, is many times the people in the legal profession file those torts and claim most of the funds, leaving the person that got injured without the funds they need to be taken care of. So this would ban liens on those third-party torts. So I also have House Bill 5168, which would streamline prior authorization procedures for PIP benefits. So the reason for that is that many times a provider and an insurance company will go into a fighting match as to whether or not you, as an injured person, should get care under your PIP benefits. So this would streamline that authorization to make sure you could get the care without having to wait for it. So I also want to see changes in independent medical examinations. So I introduced House Bill 5170. This would create a no-fault independent medical examination board to license qualified doctors to conduct independent medical exams for insurance purposes, to remove the practice of cherry-picking expert witnesses to provide only one side of the argument. So when you're in a lawsuit or you have to be examined, your doctor is going to give you a diagnosis, a prognosis, different things that would be wrong with you at that point. An independent medical exam appointed by the insurance company will come in to the same patient and say, no, you're okay. Well, that's cherry picking. So what I would like to do is we would have an independent reform board inside No Fault that would appoint those medical examiners, but not be able to cherry pick them, be random. All right, so next, I've also introduced 5171. So that would cap the fees charged by those independent medical examiners so that they can't continue to up the price. Plus, they would have to have at least 51% of their practice in clinical situations rather than just medical exams. This would say that, okay, they're really in the medical field. They know how to make those decisions. But the cornerstone piece of legislation that I've got is House Bill 4486. Now, this bill is designed to prevent caregiver providers from going bankrupt or leaving the state by allowing reasonable rates of services to continue. Now, when we made the No Fault Act a couple years ago, we took a baseline of Medicare, and that would be the base that we would use to determine how much a provider would get paid. There are percentages above that baseline. However, when we went to discharge date, we got rid of the baseline and said, okay, we're straight going to go to 55% of what you were charging before. In reverse, that means that company was making 45%. Nobody does that. So what they did, or what we did, is we actually penalized a person that was trying to do what they needed to do, but controlled costs, rather than letting the people that charge more stay in business also. So we got rid of the good people and kept the bad people. And I think that's what's going to happen as we go forward. So my bill would change it so that we've got a base rate that goes all the way through. You might need to have more information on that. Feel free to call my office. We can explain it to you. Or we've got some publications on it too. So altogether, these ideas are pitched to my colleagues to find ways to ensure that those that have been in catastrophic car accidents receive the care they need to function and find ways to drive down the cost of auto insurance to make it more affordable and accessible to the average family.